pterygoid muscles of mastication. We have two muscles of mastication of pterygoid. This one is lateral pterygoid, other is medial pterygoid. What is the meaning of this pterygoid? Pterygoid means wing-like. So pterygoid means wing-like, and before we go into lateral pterygoid muscle or medial pterygoid muscle, we need to understand sphenoid bone. So in sphenoid bone, we have a body. We have lesser wing of sphenoid, greater wing of sphenoid. In greater wing, we have foramen rotundum, foramen ovale, foramen spinosum. We have pterygoid process. Process is also known as plate. Plate means a thin sheet-like structure. So we have two plates or two process. One is medial pterygoid process, other is lateral pterygoid process, also known as lateral pterygoid plate or medial pterygoid plate. Medial because it is towards the central line or the medial part of the body. So medial pterygoid process and lateral pterygoid process. At the end of the medial pterygoid process, we have a small hook which is known as hamulus. So lateral pterygoid or medial pterygoid muscles, they arise from lateral pterygoid plate. Lateral pterygoid muscle arise from lateral surface of lateral pterygoid plate, and medial pterygoid muscle arise from medial surface. Medial pterygoid arise from the medial surface of lateral pterygoid plate. So till now we have seen the sphenoid bone from the inferior surface of the skull. Now if we look at the side of the skull or the side of the face, and if you cut the zygomatic bone, you see clearly the sphenoid bone, which is the shaded part of in this diagram. We have infratemporal surface of sphenoid bone, and this elevations are known as crest, because crest means elevated part of the bone. So this is infratemporal surface, and these elevations are infratemporal crust. And beside the maxillary bone, you also see lateral pterygoid plate. So in the side of the face, we see sphenoid bone, infratemporal surface, and the crust, and the lateral pterygoid plate or the process. This muscle, lateral pterygoid muscle, arise from infratemporal crust and the surface, as well as lateral surface of lateral pterygoid plate. So lateral pterygoid arise from two surfaces as upper belly and lower belly. Upper belly has minor fibers, whereas majority of fibers are from lower belly. Upper belly arise from one, that is infratemporal crust and infratemporal surface, whereas lower belly arise from lateral surface of lateral pterygoid process or the plate. Both of the bellies, they unite together and they get inserted into 3 and 4. 3 means articular disc of temporomandibular joint, and 4th means pterygoid fovea, which is present on the condyle of the ramus of the mandible. So origin is from infratemporal crust and the surface of the greater wing of sphenoid bone and lateral surface of lateral pterygoid process, and they get inserted as upper belly and lower belly. They get united and make it as a cone shaped muscle, and they get inserted into articular disc of temporomandibular joint and pterygoid fovea, which is a part of condyle. This is origin and insertion of lateral pterygoid. Actions of lateral pterygoid. We have 3 actions. Number 1, depression of the mandible, that is opening of the mouth. Number 2, protrusion of the mandible, that is forward positioning of the mandible. And number 3 is side to side movement during grinding. We all know that origin pulls the insertion. So if you look at this diagram, you understand that origin is at the lower level than insertion. So the first action will be opening of the mouth, that is depression of the mandible, and second action will be the protrusion of the mandible forward. Third action is side to side movement. What we mean to point out here is that the origin is towards medial side and insertion is toward outer side. So the fibers go backwards and go outwards to enter the pterygoid fovea and the articular disc. So when right pterygoid, lateral pterygoid muscle contracts, it pulls the chin towards opposite side, that is left side. Similarly, when the left pterygoid muscle contract, it pulls the chin towards the right side. So this is side to side movement in grinding. Nerve supply is by mandibular nerve, and this muscle is also derived from the mesoderm of first pharyngeal arch, like other masticatory muscles of mastication. Lateral pterygoid muscle, superficial and deep relationship. Superficial, we have 5 relations. Superficial means outward. So this is a lateral pterygoid muscle. What is outer from lateral pterygoid or superficial? known as superficial relationship. For example, the number 1 is masseter muscle is having superficial relation to lateral pterygoid muscle. Second is the maxillary artery. The third is the inferior alveolar nerve. Fourth is lingual nerve. Okay, and the fifth is buccal branch of mandibular nerve. So 5 superficial relation of lateral pterygoid. Number 1 is masseter muscle. Number 2 is maxillary artery. Number 3 is inferior alveolar nerve. Number 4th is lingual nerve, and number 5th is buccal branch of mandibular nerve. In Viva, there is a question that which structures passes through the gap of upper belly and lower belly of lateral pterygoid. We have 2 structures. Number 1 is maxillary artery, and number 2 is buccal branch of mandibular nerve. These 2 structures passes between the gap of upper and lower belly of lateral pterygoid. Now deep relationships. If this is the lateral pterygoid muscle, we have medial pterygoid deeper to it, specifically deep head of medial pterygoid muscle, sphenomandibular ligament, lingual nerve, and maxillary artery. Lingual nerve and maxillary artery was superficial also and deep also to lateral pterygoid. So deeper relations are deep head of medial pterygoid muscle, sphenomandibular ligament, lingual nerve, and maxillary artery. So these are the relations of lateral pterygoid muscle.